So there are some times that a patient comes to you with a joint issue. So you want to actually assess how far this joint issue has affected this patient. Like, to what extent has this joint issue affected this patient? All right, and you are trying to make them do some daily activities that every human being does. So you want to actually see if their activities are affected. So you are trying to access their ability to perform daily activities. So a lot of things, like they should squat, like they should comb their hair. There are other things too which you get to look at. So this is squatting. So in generally, when you want to evaluate musculoskeletal system conditions, the clinicians often access, your everyday activities. So your everyday activities, if they are affected, they to give me a very, nice overview of how this disease condition has affected you. Do you understand? So if those tasks reveal how well the joint is working, okay, or how far it is actually what affecting you. So let me say, if you want to access the knee, you squat, you're trying to test knee flexion, quadriceps strength, joint stability. Difficulties in pain will now start suggesting to you that you have all those arthritis, ligament injuries, and meniscus damage. You can ask the person to walk upstairs and also down the stairs. So troubles descending the stairs often indicate that there's a patellofemoral problem. So the patellar hammer is kind of like giving way. Do you understand? So then for the hip joint, okay, that's knee. So hip joint, you can ask them to cross their leg or put on their shoe. You understand? Then crossing the leg requires hip flexion and adduction. Of course, for any activity you are asking them to do, you know what you are looking for, right? Putting on the shoes and socks. So any difficulty may now indicate that there's a hip pathology. That's what arthritis and stiffness. Then for their hand and wrist, you ask them to do fine movements, like they should button their shirts or grip an object. So buttoning shirts requires fine motor skills and finger flexion and extension. So if they are not able to also grip something, shows you that there's weakness. So weakness may suggest tendonitis, carpal instability, or arthritis. And spine assessment, you ask them to bend down or reach for something or lift something. Do you understand? So why all that matters is it provides a real time insight to what this patient is going through. Do you understand? It also helps to track progress in rehabilitation and also guides treatment decision. May highlight the several limitations that patient is facing in their daily life.